Hey guys, this week's content series goes out to Big Banger 137. She wanted to learn more about knee health functionality and how to give yourself a better one. So that's what we're going to do this week. Too deep into this knee talk, I want to bring up the upstream downstream concept, which essentially states the area of discomfort or pain isn't really always the cause, right? So if my knee hurts, if I go upstream, that would be my hip. If I go downstream, that would be my ankle. Because the body operates in relation to each other, we're going to go over the hip and ankle later on in the week, so definitely stay tuned for that. First things first, before we can talk about the knee, we must learn the structures of the knee, especially the ones most vulnerable to injury. If we're talking knee injury, guys, sports specific or otherwise, we're going to talk about specific structures. So we're talking meniscus, the ligaments around your knee, so like your ACL, your PCL, more so. And then we're also talking your patellar tendon. First up, guys, is the meniscus. The meniscus is a pad that exists in between your thigh bone and your shin bone. It provides shock absorption, and it can be injured when you apply a lot of pressure to it and then the twist very rapidly. So guys, next we're talking ligaments. They attach bone to bone, specifically femur to your tibia. They are going to provide stability to the knee, and they're going to actually absorb lots of times shear or longitudinal force. Patellar tendon secures your kneecap in place and actually extends all the way down from the quad and quadricep tendon. It can be frayed due to chronic and overuse injury, or it can be acutely torn via something traumatic. So guys, most of you know that the knee is a hinge joint, meaning it opens and closes like the elbow does. But that is not its only function, especially required of a healthy knee. There actually is a slight bit of rotation that can occur there as well. You need to strengthen that to keep it safe and healthy. Most athletic endeavors and dynamic movements require tibial rotation and glide of some sort. And even if that's not your jam, movements like the squat and the deadlift still require those to some degree.
Rotation, guys. You need the yoga blocks up you can squeeze. You're going to focus on moving from this point right below your knee. You're going to try and change the way Spider-Man is facing. We're going over tibial rotation and glide. Notice I'm going to put my hand on my foot right here. Oh, shit. No, your hand on your foot here. You're going to send your hip outwards like so, forcing your tibia to glide laterally. Only move as far as you can keep your glute and hip engaged. Bring it out.
Hey guys, this week's content series goes out to Big Banger 137. She wanted to learn more about knee health functionality and how to give yourself a better one. So that's what we're going to do this week. Hey everybody's day 2 of the content series. So we're going to be talking about your hip in relation to your knee. So guys, remember yesterday I mentioned the upstream downstream concept. Essentially what that states is the area that is symptomatic or having pain may not be the actual problem area. So if we take the knee and it has pain and we go upstream, we find ourselves at the hip. So guys, a healthy hip should be able to do the following. It should be able to go into hip flexion, hip extension, hip abduction. It should be able to perform external rotation and internal rotation in those positions and ranges I just mentioned. Hey guys, I cannot stress this enough. The inability to perform any of the ranges of motion I just listed can possibly lead to knee pain, especially if you're forcing yourself into these positions. So we're going to use 90-90, one of my favorite mobility positions, to assess the ranges of motion of your hip. If you want to take a video of yourself and tag me and post it to your feed or your story, I will give it a critique.
90-90 ER assessment. You're going to keep the back foot down, lift the knee up as high as you can, keeping your torso from turning this way. You want to stay as far forward as possible. If you can only get to here, that's okay, guys. We do the 90-90 IR assessment. This knee is going to stay down, the foot is going to come up, and you're going to lift it as high as you can. If you can't at least get it off the ground, that's no good. You should feel this muscle in your hip assessment. So you're going to keep the leg flat on the ground, keep your arms stable. You're going to lift your whole leg up off the ground like so. Show you from a different angle. Whole leg comes up. Now what you don't want to do is you don't want to shift all the way over here. So deep 90-90 hip flexion assessment. You're going to bring your leg up from here. This leg still stays in 90. Keep the hands planted. You're going to try and lift the knee towards the shoulder. If you cannot get that off the ground, that's no plan. 90-90 hip extension assessment. So you're going to get into your 90-90 position. Stabilize with the arms. You're going to crush the ground with your whole leg and slide it back and extend the hip. If you cannot get your knee past that parallel position, that's the problem. So in the adductor assessment, you're going to slide this foot slightly forward, bring it up like this. You're going to try and keep facing forward. You're going to try to bring this leg to the ground while continuing to face forward like so, using your abs.
External rotation of the hip, often performed by muscles like the glute, allow the hip to go out and torque. Doing this motion in something like a squat allows the knee to properly align over the toe, keeping your knee nice and safe. Hip internal rotation, often performed and or aided by muscles like the TFL, are utilized in movements like walking and running and help give a slightly greater degree of what's called hip extension. Hip flexion, performed by the iliopsoas complex, is the ability for your knee to rise and go above and beyond your hip crease. It's used in obviously activities like walking, running, and exercises like the squat. So hip abduction, often performed and aided by the TFL, is the ability for your hip to go outwards and away from you. Now, if you've seen someone play basketball and someone, cross someone over really bad, break somebody's ankles, boom, hip abduction was used there. Adduction is the ability for your hip to pull your thigh bone inwards, often aided and performed by muscles like the adductors. Is essential for stability, below parallel, helps with hip extension. Adductors. Hey guys, can't forget about hip extension. Hip extension, performed by very strong, big, powerful muscles like the glutes and hamstrings, are often the driving force that propel you forward. Hey everybody, I want to let you guys know that I've gotten a lot of great feedback from today's content series, and I want to let you guys know that if you have questions, not only can you ask them, you should ask them. I'm always open to have conversations, and I want to help people and inform them. Guys, today's the last day of the knee content series, and it's time to ask yourself, what that ankle do? We're talking about the ankle today because it is downstream from the knee. So yesterday was about the hip, which was upstream, and we know from the upstream downstream concept that if we're looking for problems at the knee, we need to travel to those two places and assess them. We have four main ranges of motion of our ankle foot complex. We have dorsiflexion, knee going over toe, plantar flexion, think calf raise. Then you have eversion and inversion, and that's just essentially how the foot sits. Remember that all ankle ranges of motion are important, right? But the one that I see people get into the most trouble with and most commonly based off like sports, athletics, or just exercise, is dorsiflexion. So dorsiflexion, guys, the ability for your knee to travel over your toe, allows for better and deeper squat mechanics, and allows for other things like deceleration, right? Like, why go super, super fast if you just got to fall over to decelerate? But if people are curious about their dorsiflexion, what should they do? Should they do an assessment to help them better their dorsiflexion? Is that what you're thinking? Is that what you think? Maybe. Okay, cool. Well, we'll show the world a dorsiflexion assessment. So guys, we have your dorsiflexion assessment. You're gonna take your fist, bring your foot one fist width off the wall. Then you're gonna try to see if you can get your knee to the wall without the heel coming up. Heel must stay down, knee must touch wall. Give it a try. Hey guys, if you find that your ankle could not touch the wall, that is okay. Go ahead and just say help in the question box below, and I will actually send you some exercises to help your ankle dorsiflexion.